Good evening, everyone. It's Dr. Charlotte Hodges. Tonight I wanted to talk a little bit about weight regain after surgery. This is definitely a concern that some of my patients have, and it's certainly an issue that I like to address as soon as I can. When my patients come into the office, I always want them to feel safe and have the opportunity to know that I'm their biggest advocate. I never want patients to think I'm going to be really angry at them if they don't do well or if they begin to regain some weight. I want them to come in so that we can try to address the issue so that things just don't get out of control. I'm never going to be mad at my patients, except if they don't do their protein. But if they're having issues where they're starting to see a little bit of weight creep on, or maybe they've plateaued earlier, I really want to be able to try to help them. Studies are now showing that patients will begin to plateau out after about the 12-month mark. And if somebody is going to begin to have some weight regain, it's generally around that 12 to 18-month mark. That's where we're starting to see the most issue. And so it's really important that our patients have good follow-up, because all the studies are showing, but it's also kind of common sense, if you keep good follow-up, that's going to give you that good accountability, and it's going to give you the best chance to have good long-term results. Typically, I'll see my patients a week after surgery, a month after surgery, and every 3 months after that. By the time that you've met your 6-month mark, you really should have lost at least 50% of that estimated weight loss or that projected weight loss. For instance, let's say you're having a gastric bypass and you have 100 excess pounds. Generally, you should have lost, or we're estimating that you're going to lose about 75 pounds. So by the 6-month mark, if you're supposed to lose about 75 pounds, you really should be down at least 35 to 40 pounds at that 6-month mark. Now, for the vast majority of people, they're actually going to reach that 30 to 40 pounds definitely by the 3-month mark. But I kind of look at the 6-month mark as a halfway point. Halfway point for weight loss, halfway point for you meeting your projected weight loss goals per the surgery that you've had. Around the 9-month mark, whenever my patients come in, I then try to look at their weight loss, how close they are to their projected weight loss, and really what the patient's weight loss goals are. If my patients are getting really close to their weight loss goal, and maybe they have only 10 more pounds to go, or maybe they want to be super aggressive and they want to lose another 20, 30, or 40 pounds, or maybe for whatever reason, they haven't met their goals, this is around the time when I really try to be aggressive. In my practice, I always try to, around the 9 or 12-month mark, I try to look and do some metabolic studies on them so I can get a better idea of where the metabolic rate is, how many calories they need to take in to maintain their weight, and what they need to do to lose weight. Now, if your surgeon does not have an indirect way, the indirect calorimetry to measure your resting energy expenditure, there is an equation called the Mifflin-St. Jeor. It's a kind of a good guesstimate to try to see where your metabolic rate is. But if you can actually get a review machine and get this testing, it really is helpful. I generally try to get a metabolic study on my patients at around the 9 or 12-month mark. That way I can get their resting energy expenditure, and from that I can get their weight loss range, so the calories where they're going to lose 1 to 2 pounds a week. Now, why is that important? Because we always hear you want to lose weight safe, 1 to 2 pounds a week. Why do we talk about that? Well, for every person, when you lose weight, you're basically putting your body in a calorie deficit. And that is all going to be based on your resting energy expenditure. You're going to have about a 200 to 300 calorie range where you're losing 1 to 2 pounds a week, where when you're actively losing weight in that range, you're not having a really negative impact on your metabolism. If you fall below that range or that calorie range for a significant period of time, you really can begin to have some slowing of your metabolism. And that's why whenever patients go on these crash diets, they're only taking in a couple of hundred calories a day, and they're doing that for several weeks on end, their body is going to go from short-term starvation to long-term starvation, and you're really going to begin to see some slowing of your metabolism. What I recommend for my patients is try to find out what their resting energy expenditure is. Try to find out what their goal is. And then from there, talk a little bit about their appetite and their satiety. There certainly is this kind of honeymoon phase in bariatric surgery where you have no appetite, you don't want to eat anything, you're not hungry, you're not really thirsty. But that feeling does not last forever, and that's okay, that's normal. However, once that feeling begins to go away, and now you're at the 9-month mark, you're at the 12-month mark, you're at the 18-month mark, and this is a time whenever patients really begin to plateau and they can be at risk for beginning to regain weight. This is whenever I like to address their eating habits and their behaviors, because those are one of the strongest components in the issues that we need to address to make sure that you have good long-term success. In my practice, I certainly will use different weight loss medications, even after patients have had weight loss surgery, in an effort to address cravings or even feelings of hunger. I also like to address patients' anxiety, depression. For most of my patients, if I'm starting to see a kind of a change in their weight, all I have to do is sit and ask them, what's going on in your life? What changes have you had at work? What changes are going on with your family? And it doesn't take long to see that stressors in your life can have a profound impact on your behaviors. If you're having a lot of stress from work, a lot of times the first thing you want to do is get home, either have a cocktail or you have your dinner and then you get the munchies. If you're starting to see these behaviors, the very first thing I would do is, if you have the munchies and you have the snacks in the house, you got to get rid of them. If they're there, you will eat them. I know in my house, I love chocolate, and right after the holidays, so after Christmas, after Valentine's Day, after Easter, the chocolate goes in the trash. If not, I'll eat it. I will eat it before my daughter will. And so those are the types of things that I like to address with my patients. So addressing the stressors that are in their life. However, if I find that my patients are having issues with cravings or issues with hunger, I will use different medications on the market. There are 3 really good medications that I like to use. I like Saxenda, I like Contrave, and I like Qsymia. I find that Qsymia, which is a combo pill of phentermine and Topamax, that's really good for appetite suppression. Contrave is really good for craving control. And Saxenda, I find, is pretty good with my bariatric patients, particularly those that have had a metabolic surgery, such as the bypass or the switch. Generally, my switches don't really need weight loss medication. They have really some profound weight loss with little to no risk for weight regain, but my gastric bypasses really seem to do well. If they're having a little plateauing of their weight, or if they want to lose some more weight, they respond well to Saxenda. The upside with Saxenda, you can lose weight if you've had a bypass. The downside is sometimes insurance doesn't cover it and can be fairly costly, and it's also an injectable, so not everybody likes to use an injectable pen. I would suggest that you just talk with your provider, if you're not one of my patients, about the different medications that are out there. It's perfectly safe for you to have one of these medications, even if you've had weight loss surgery. That way you can really finally meet your weight loss goals. Or if you're just trying to get off that extra couple of pounds, or maybe it's 5 years after surgery, you've had a little bit of weight regain and you really want to knock those pounds off, those medications can be a really good tool in your arsenal to really help you with some further weight loss. So looking at your behaviors, using medication, and last but not least, you got to get out there and move. When you're trying to lose weight, diet is the most important thing. When you're trying to maintain weight, it's going to be exercise. So I really encourage all my patients, try to get in your 150 minutes a week. You can do 10-minute blocks. It's totally fine. You're going to get the same health benefit. But really try to move every day, because it's that moving, getting your heart rate up, that's really going to help give you the long-term benefits. So I hope that this has helped. Don't forget to like us online and subscribe to this video if you find that it was helpful. But again, I encourage you, talk to your healthcare provider. And if you're one of my patients, come and talk to me. I want to help make sure that you can get to your weight loss goals. Have a good night.